I'm Anita Hazari. I'm a consultant plastic surgeon here at Ashford Hospital. Ladies who come to me requesting breast enlargement often come because they feel very self-conscious and lack self-confidence. It's because quite often again they have very little breast tissue and they feel that when they wear a dress it doesn't actually fit very well. Again, when they wear swimwear on a beach or are there in a bikini, they find it's embarrassing. So the request often is to give them some enlargement which is in keeping with the rest of the body shape. In terms of shape, there are two types of breast implants available. There's the round ones, which give a global fullness to the breast. Having said that, if somebody wants a very modest increase, and because majority of the times I tend to place the implants in what is called dual plane or partially under the muscle, with time they actually end up looking very natural but still give the fullness in the upper part of the breast. The teardrop implants are very useful for those women who are completely flat-chested, where the underlying shape of the implant gives shape to the breast. Teardrop implants are also called anatomical implants. There is, however, a limitation with these, that they do have to maintain a 12 6 o'clock axis, in that the upper part is relatively flatter and the lower part is fuller. And the problem is that sometimes these can rotate, which means they can flip over, and if they turn where the full part is in the upper part of the breast, it tends to look a little strange and then requires corrective surgery. In terms of the filling of the breast implant, there are the saline ones, which are also known as tissue expanders. In the UK and Europe, we tend to use these only in a reconstruction type of scenario, where some ladies who've had mastectomy are having reconstruction with a tissue expander, which in the future is then replaced with a silicone implant. For most of the cosmetic cases, we tend to use silicone implants. Breast augmentation surgery is performed under general anesthetic as an inpatient, which means an overnight stay. Sometimes it can be performed as a day case. But I encourage most of my ladies to stay overnight because it will feel quite tight, and the larger one goes, the more it feels tighter. And some of my ladies describe it as a feeling of a truck sitting on a chest feeling. The surgery under general anesthetic is where I make an incision in the crease of the breast, so in the where your future underwire will sit of the bra, and then make a pocket underneath, partially underneath the muscle, like I explained, something called a dual plane. The cavity is then cleaned out with a solution of antiseptic and antibiotics, and then I use a special funnel called a Keller funnel, which looks like a rather large sterile piping bag. And the implant goes straight from the box into the Keller funnel, and then that's placed straight into the cavity, so it has no chance of coming in contact with the surrounding skin. The idea being to try and minimize as much as exposure to the surrounding skin or to the air. Once the surgery is complete, then I suture it with dissolving sutures, and it's dressed with dressings which stay on for a week. You're then seen the following week for a wound check. For most of my patients who are in sedentary jobs, I encourage them to take 2 weeks off work because initially it will feel tight. It does generally take about 10 days to 2 weeks to start driving again. For those of my ladies who are doing physical labor, such as cleaning or lifting heavy things, then I suggest taking about 2.5 to 3 weeks off work. Like all surgery, breast augmentation also carries complications. The main ones are similar to other operations such as bleeding or infection, the fact that the scar will remain red and lumpy for several months and take 18 months to fade. But very specific to breast implants, I say to especially my younger ladies in their 20s and 30s, I say that it is a bit like a dog, not just for Christmas, it's for life. Breast implants is a long-term financial commitment because a set of breast implants will last 10, maybe 15 years, and at some point it will need changing. The two main reasons why implants need changing is because of ruptures or leaks, where they can actually leak out, and the second main reason is capsular contracture. So all women who have breast implants, the body forms a scar tissue lining around that implant, which squeezes the implant a bit like a shrink wrap and makes it go hard. And when it eventually goes hard and becomes painful, then the patient would want to have that changed. There are a couple of other very serious things which we have learnt about in the last 6-7 years or so. The first of these is something called anaplastic lymphoma, or ALCL. It's a cancer of the immune system and only happens in women who have breast implants. It doesn't happen in women who don't have breast implants. It is fairly uncommon, and the current incidence is supposed to be 1 in 24,000 women. It usually presents 7-8 years after the breast augmentation, where one side swells up, and when an ultrasound scan is done, it shows fluid around that implant. That fluid then has to be sent off to be looked under the microscope, and if it's positive, then the implant lining, which is the capsule, and the implants on both sides have to be taken out. The next thing we know, which is talked about a lot on forums on the internet, is something called breast implant illness. There's no diagnostic test for it, and it is self-diagnosed by ladies who have breast implants. They often feel that after they've had breast implants, their quality of life has decreased in terms of having things like memory loss, hair loss, fibromyalgia, multiple joint pain, blurring of vision occasionally, rashes. So it's a cluster of symptoms which could happen with lots of other diseases and conditions as well. But the diagnosis is made by the patient to think that they have breast implant illness, and often they come back to have those implants taken out. So if you're considering breast implant surgery, it is done very frequently here at the One Ashford Hospital. It involves 2 consultations. The first one when I will counsel and see whether you are actually suitable to have the breast augmentation surgery, and the second one to do what we call sizing up breast implants, because it's important to find implants which suit your body shape and also your breast dimensions. We don't want an implant so large that it starts under the chin and ends up under the armpit.